Welcome back to help you with type 2. Today I'm going to walk you through the diagnosis criteria and the glucose numbers associated with the cutoffs for what the normal, prediabetes, and diabetes. I'm Julie Scalisi, a registered dietitian and certified in diabetes care and education in the US. I'll begin by describing the tests and then move to reviewing the numbers. Type 2 diabetes is diagnosed by blood glucose criteria. If there is suspicion of type 1, there are other autoimmune markers that are usually ordered based on the presentation of the person to the person ordering the labs. So there are 4 glucose lab measures to diagnose diabetes: fasting glucose, A1c, a random glucose along with symptoms, and an oral glucose tolerance test. A1c, I'm going to start with, also known as glycohemoglobin or hemoglobin A1c, is a pretty slick test. It actually gives a reflection of average blood sugar over the last 3 months, roughly. So hemoglobin is the protein that lives in our red blood cells that carries oxygen. And there's a small portion of it that's called an A1c. And red blood cells don't require insulin for glucose to get inside of them, unlike cardiac cells and skeletal muscle cells and fat cells. So if there's glucose in the bloodstream, which there is, however much glucose is in the bloodstream, that same amount of glucose is going to make it inside the red blood cells. And protein and sugar like each other, and sugar attaches to protein, and it is a irreversible attachment. So every day our bone marrow is making new red blood cells, and every day old blood cells, after they've had their lifespan of 3 or so months, go away. So when they draw a sample of blood, there's new cells and old cells in there, and they measure the amount of sugar that is attached. And the amount of sugar that is attached to that piece correlates to what your blood sugar is over the span of the cells in that sample. So it's pretty cool. That's what caramelization is in cooking. Same idea. Okay, so fasting glucose. So fasting glucose is at least an 8-hour fast. No one ever talks about the long end of that. It's really like 8 to 12 hours. If you fasted longer than 14 hours, our body is kind of going into different mode of starvation mode when it's a really extended fast. So if it's been more than 14 hours, I would probably wait to a different day when you can just go in with an 8 to 12-hour fast. And these all need to be done in the lab, not by a home or a clinic-based glucose meter with a finger stick. Random glucose just means at any time of the day. The diagnosis of that is associated with the cutoff number along with symptoms of high blood sugar. Glucose tolerance test is a test that you go into the lab, you get a fasting lab done in the morning, or fasting lab done, and then you drink 75 gram glucose syrup, and you sit there for 2 hours. You can't be walking up and down the hall because you're bored. And then they retest your blood sugar 2 hours later and see how your body is handling that glucose load, and is it able to dispose of and utilize that glucose or not. So confirmation of the diagnosis of diabetes takes 2 results, except for if you go in with symptoms of high blood sugar and the lab comes out positive. Otherwise, you need 2 results. They can be on the same day, or if you have to go back because it was like, oh, we're expecting that, to get a confirmation test on another day. So the result categories are either normal, prediabetes, or diabetes. Glucose numbers don't differentiate type of diabetes. In the United States, we use a percentage for hemoglobin A1c and milligrams per deciliter for blood glucose numbers. Pretty much the rest of the world uses metrics, but oh no, we wouldn't want to use metrics here in the US. So I did include the metrics numbers in parentheses on these slides, on most of them anyway. So normal fasting blood sugar for all three of these categories of testing is a fasting between 60 and 99, an A1c between 4.5 and 5.7, and the 2-hour glucose of under 140. Prediabetes is 100 to 125 fasting, A1c of 5.7 to 6.4, and between 140 and 199 if you had an oral glucose tolerance test. And diabetes is diagnosed either with the random sugar of over 200 along with classic symptoms of diabetes. So high blood sugars are what are associated with symptoms. If you get diagnosed with your blood sugar in the lower end of the cutoff, you don't have symptoms of high blood sugars because they're not high enough to make symptoms. But these are the symptoms of pretty extreme high blood sugars, and usually have to be, running over 200 for weeks or months before people might start feeling symptoms. Excessive thirst, frequent and a lot of urination, being hungry all the time while losing weight, which is unexplained weight loss. So sometimes when people find out what's wrong, it's almost a relief that it's diabetes. So for diabetes, I thought I already did this. Fasting 126 or higher, an A1c of 6.5 or higher, or a 2-hour glucose challenge of 200. And this is the summary of all those categories, because I kind of went through those pretty fast. If you want to do a screenshot or whatever, I'm saving that one. The other thing that I just wanted to kind of chat about a little bit is that the normal A1c range and how that correlates to average blood sugar in when diabetes or prediabetes or abnormal glucose tolerance is not present. So average blood sugar and averages of 84 to 115. Our body naturally keeps glucose in an extremely narrow range. And so when things start happening in our metabolic signaling that, messages aren't getting relayed for the things to keep glucose in check, and they're just kind of all wackadoodle, that our metabolism is not working right, and it messes stuff up in how blood sugars are running. And then when blood sugars are running high, it increases inflammation in all of our body cells, and it's a real problem for long-term health of our cells and tissues and organs. And so when you get diabetes, you have to personally step in and be responsible for getting your metabolism fixed. And this is not a small chore. And there are so many different parts that can be affected of where the problem is going wrong. And we're getting better and better at managing diabetes and trying to streamline, well, let's, what piece is broken, what pieces, but there can be up to like 13 things that aren't working right, because of this, that, or the other thing. And so it gets confusing. And so we're here to help, and just be patient with yourself and be persistent and allow yourself time to learn and practice. That's my spiel for today.